According to Johns Hopkins University, they have a coronavirus tracker going there. More than 9.6 million positive cases of coronavirus now in the United States. And the death count has now risen to more than 235,000. I want to talk more about this pandemic now with Dr. Sejal Hathi, physician and clinical fellow at Massachusetts General Hospital and host of Civic Rx podcast. Doctor, thank you so much for joining us today. I'd been mentioning in the last interview that just yesterday, I had announced that on Wednesday we had seen a case count of 100,000, which was a record. And now we wake up this morning and we find that the case count for yesterday was roughly 120,000 cases, which seems an incredible pop there in just 24 hours. It had almost seemed unthinkable that we would ever hit numbers this big. I'm wondering where you see this pandemic going in the next month. I mean, especially if we're seeing numbers surge like this in just 24 hours.
Yeah, Kristen, we are in an incredibly grim situation. Here we are 10 months into a pandemic, exceeding 100,000 cases that we know of across the nation in a day. We've seen 51% of an increase in cases in the last 2 weeks. Likewise, a 30% increase in hospitalizations, with being on track to hit an all-time record next week. And deaths for the fourth week in a row are additionally climbing. And Kristen, what worries me is that what's different about this surge we're in now as compared with those in the spring and the summer is that it's all across the country. When we started out in March, we had a really dense epidemic in New York, then we saw it spread to the Sun Belt. But right now, 48 of the 50 states across the country have an R-naught value exceeding 1, which means that the epidemic is expanding. We have a 7% test positivity rate across the country, which perhaps sounds low, but the WHO recommends that we keep that number under 5 to curb transmission. South Korea, as a point of comparison, is at 1%. And right now, about 15 states have a test positivity rate exceeding 10%. So this is not at all a good situation. And I think that we're going to continue to see these cases accelerate across the country over the course of the next month.
We've heard of some cities essentially say, hey, we're going to be going into some state of lockdown. And it is something that's been whispered about, I think, by various officials over the last couple of weeks. However, I don't think most Americans really have an appetite for lockdowns. Of course, remembering what we had to do in March and through into the summer. And considering that we have so much coronavirus fatigue, I think people would really be unhappy if we had to go there again. However, as you're seeing it and as you're mentioning some of these facts and some of these stats around this virus, are you looking to yourself or thinking to yourself rather and saying, okay, we're going to have to lock down in December if we keep going the way that we're going, or January, or whatever it might be?
Well, Kristen, I think that's a salient question. And I would say that Europe right now presents a profoundly cautionary tale. We're seeing leaders across Western Europe who just a few months ago averred that they would never re-enter a lockdown, now unfortunately resorting to that last recourse. I don't think that we have the political appetite to enact a nationwide lockdown, and I hope that we don't actually get there. But what we do need are targeted mitigation measures. And so those cities and those counties that are suffering from a widespread outbreak right now should be considering instituting, as you alluded to, stay-at-home orders and more severe restrictions. We know what we need to do. There was a Nature Medicine report that was published just a few days ago that stated that if 95% of Americans across the country consistently wore masks in public, the estimated death toll over the next few months would drop by 130,000. Right now, only half of Americans are estimated to be wearing masks consistently in public. So we know what we need to do. We need to maintain physical distancing. We need to wear masks. I know that public health experts sound like a broken record, but these are very simple gestures that could save a lot of lives. And I'm hoping that either the Biden transition team or the Trump administration over the next couple of months buckles down and begins to recommend these more insistently.
So let's talk about that, right? Because a lot of people had been saying, listen, you're not just going to be voting for the president this year, you're also going to be voting around coronavirus and essentially the strategy to tackle coronavirus. Former Vice President Joe Biden had already come out and said that if he was elected president, and right now the numbers are looking that he might, that he would be implementing a national mask mandate. However, even if he becomes the president, he doesn't take office until January. We still have several months to get through with this virus surging around the country before we can even get to perhaps a national mask mandate. And we've already seen how President Trump has reacted around this virus, holding rallies that are maskless, for example. So then what are you expecting between now and January when potentially a new administration takes over?
Yeah, Kristen, I think this election was in many ways the public health election. Exit polls showed that 4 out of every 10 voters cited the coronavirus outbreak as their foremost issue of concern beyond any other issue. And of course, voters split along partisan lines, with Trump voters overwhelmingly prioritizing the economy. But the reality is that voters are concerned about this. And one point I want to note additionally is that the AP came out this morning and said of the 376 counties with the highest rates of infection, over 95% of them voted for Trump, which goes to show you that his base, a lot of people in this country are not convinced of the importance of these simple measures that we talked about over the last couple of months. So I think it's really incumbent on a Biden transition team to begin promoting trust again in our institutions and in our scientists, to allow its task force to speak more clearly to the American public, to work with the Trump administration to say, look, you need to alter your messaging. You need to promote mask wearing, because right now the virus is beginning to accelerate across the country. And these next couple of months are going to be really critical. By January 20th, when the next president is inaugurated, COVID-19 is going to be spreading rampantly across the country. So we really need to be preparing now and messaging now to the broader public that these basic public health measures are essential.
All right, well, thank you for that. And some of that critical and important data. Dr. Sejal Hathi, physician and clinical fellow at Massachusetts General Hospital and host of the podcast Civic Rx. Thanks so much for joining us today.
Of course.